Hello, I'm Dr. Dinesh Verma. Welcome to my e-learning series on how to develop a lucrative yet ethical medical practice. Today we're going to talk about how to create a bond of trust between the patient and yourself. When a patient comes to you, you develop a doctor-patient relationship. The first and foremost in that relationship is that the patient trusts you. So, what are the things to remember in developing that bond of trust? I think the most important to my mind is transparency. Transparency in the information that you're giving to the patient to the best of your knowledge, and transparency about the financial transactions. So, regarding the information, the patients these days always consult some social media or friends and family, and they have some knowledge about their condition. But you have to manage those expectations by giving them honest opinions. So, in this context, I would like to explain to you about informed consent. Informed consent is not only for procedures, surgical procedures, but also for giving any treatment to the patient. You must ask their consent. By and large, these are presumed consent when a patient fixes an appointment to see you. But when it comes to procedures, you have to have a formal dialogue with informed consent. So what is the informed consent? As the name suggests, you have to inform the patient about the therapeutic means that you're going to take and the treatments that you are offering, after obviously taking their proper history as well as carrying out the investigations. Legally, it is not just a piece of paper where you print out something and get the patient to sign, which becomes informed consent. That paper has no value. The real informed consent is when you inform the patient about the benefits and the risks of the treatment or the surgical procedure you're going to perform. You also give them alternatives and tell them, if they do not have this done, what are the options for them. This is an important issue in medical legal cases, and there have been several instances where the patients have won a medical negligence case against a doctor because they did not take a proper informed consent. Coming to the second part in the transparency, those are the financial transactions. If you're in private practice, it is extremely important to have that transparency about financial transactions. So first of all, you need to inform the patient of your fee structure. If you are going to do extra procedures or provide extra services, how would you be charging for those? And if you are going to take them to a hospital, they need to be clear about the whole package. There should be no hidden charges. As we know, the medical insurance is now becoming quite a common thing in India, and a lot of patients come with their papers about the insurance, and there are some unscrupulous doctors who are willing to make the patients or willing to help the patients in making false claims more than what is actually due to them, or even give false certificates. This is something that you must resist. In the short run, it may look like you're benefiting the patient, but it is extremely dangerous for your own practice, the integrity as well as the trust that you develop with the patient. If you indulge in these practices, then you will never have an ethically clean practice that patients can trust. Conflict of interest, both in financial matters as well as in other medical matters, must be made very clear to the patient. If you're referring them along to another investigation lab or to another specialist, and if you have a financial arrangement with the lab or the doctor or the hospital that you're referring them to, then you must inform the patient. It is in fact better not to have a specific referral. You should give a few options, especially in the case of investigations and the lab tests. That creates a bond of trust with the patient if you give them a few choices and do not insist that you must go to one particular lab. Coming to the next part of creating a trust is to manage the patient expectations. So we've already talked about informed consent. Managing expectations are giving them information which is reliable and clarifying to them what information is to be followed and what is misinformation on the social media. This is a very important aspect, and you have to manage the expectations very well. Thank you for listening to my e-learning course. We will be back with another topic next time. Thank you.